Good morning. Welcome back to my YouTube channel, Medical Classes by Dr. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. You can make use of it. Thank you very much. So we have been discussing about the differential diagnosis of muscular dystrophy, especially DMD and BMD. In that context, we have seen two important disorders. One is myotonic dystrophy, another one is limb girdle muscular dystrophy. And we have also looked into their clinical presentation and method of differentiation. Now talking about one more important disease which creates confusion in diagnosis of muscular dystrophy is Emery-Diffuse muscular dystrophy, which is also called as EDMD. EDMD. Now, this EDMD is also called as scapuloperoneal or scapulohumeral muscular dystrophy. If you recall back the 10 patterns of muscle weakness that I have explained in few days back. So there we can find one type of distribution of muscle weakness where the muscles of the eyeball, muscles of the shoulder, muscles of the upper limb, okay, muscles of the lip area, face area get affected. So this is one type of such distribution where scapuloperoneal or scapulohumeral muscular dystrophy. Now, if you look into the details, this disease is actually very rare. This disease is actually very rare. This is one of the X-linked recessive disorder. Okay, X-linked recessive disorder. Even DMD is also X-linked recessive disorder, which is more commonly seen in male. And the locus is XQ at 28, that is mutations that cause the myotubular dystrophy. The mutations which is happening in the particular XQ 28 region of the gene, it is causing a problem with the myotubular dystrophy. And this will be also associated with the neonatal adrenoleukodystrophy and incontinentia pigmenti. Usually, embryonic muscular dystrophy, of course, this is very rare. When it is there, it can be presented in the isolated way, or sometimes embryonic muscular dystrophy may be associated with the adrenoleukodystrophy. Adrenoleukodystrophy is one of the white matter disease, and also the incontinentia pigmenti. Okay. Now, symptoms begins with the middle childhood age. Okay, muscle weakness will be there. Muscle weakness will be especially eye muscles, facial muscles, and then the upper part of the limbs, etc. And also in the peroneal region. Usually the symptoms will begin in the middle age, and the child may survive up till adulthood. Okay, life expectancy is there up to adulthood, although child undergo ambulation. Now this is actually slowly progressing. Compared to DMD, this is slowly progressing. And there will be no hypertrophy of the calf muscles. Again, there is no hypertrophy of the calf muscles. Contractures of the elbow and ankles may develop very fastly. Okay, when you look into the limb girdle muscular dystrophy, the contracture development is a little slow or there is no contractures. Whereas in case of embryonic what happens is the contractures develop very fastly. Muscle will be rested in the scapula, as the name suggests, scapuloperoneal, scapulohumeral. So scapular muscle will be always undergoing atrophy, wasting, and this wasting will be of that particular pattern where scapular muscles, humeral muscles, and peroneal muscles are affected, and there will be no facial weakness. Hence, the differentiation from the myotonia of the neural origin. Okay, so facial muscles are not much affected. Exactly the facial muscles like mastication muscle and all, they are not get affected. Now, CPK levels, if you see, they are mildly elevated. There is no massive elevation of the CPK. This helps to differentiate from the other X-linked recessive muscular dystrophy like DMD. In DMD and all, initially the CPK level will going to rise very high. Later, it comes to constant level when everything is over. That means muscle dystrophy is completed. It comes to the constant level. But initially it rises very fastly. But this will not happen in case of Emery-Diffuse muscular dystrophy. So this is another important differential diagnosis for muscular dystrophy. One more important differential diagnosis is congenital muscular dystrophy. Congenital muscular dystrophy. So that we will see in the next class. Thank you very much.